today we have Nadeena, aka Nads. Nads is an APA titled musculoskeletal physiotherapist.
Not yet.
Not yet, but
Not
soon
yet.
soon to be.
Yeah, yes, correct.
And he's a director of Head2toe Physiotherapy. Do you want to tell us a bit about yourself and introduce yourself?
Oh, yeah. So pretty much, I'm a physiotherapist. I run Head2toe Physiotherapy and Podiatry. I was always a really sort of motivated person as a graduate, and really liked taking care of patients and doing the best I can for them. But had sort of aspirations to do that at sort of like a large scale. So yes, being able to do good by my own patients, but help other people and other clinicians around me also do the same thing and also be the sort of best versions of themselves, so that they're able to amplify their effect onto other people. Yeah.
Cool. Correct me if I'm wrong. You graduated in 2020.
Yeah.
And within 2 years, you took over the clinic that you're working in.
Yep.
What was that process for you, and what was your mindset at that time?
Yeah, it was a lot of planning. So pretty much, I think from even when I graduated and even before I graduated, I know I was a person that personality traits wise wanted to be in charge. Okay. Wanted to have my own brand, my own business, but really didn't have the sort of tools around me to do that.
So my question is, what made you realize that you could do it?
To be honest, I think in a way it wasn't a case of if I could do it, it was a matter of when.
Yep.
I would figure out a way somehow. And it was just a matter of when that would happen. If I was ready or not ready, if the opportunity was there, I'd have those sort of plans in place to actually do it. And that's what I was doing all that time in undergrad and early on as a graduate. Is I was planning.
All your life, yeah.
Yeah, all my life, just waiting for that opportunity. Didn't have a lot of financial resources or anything like that, or to help that. So I had to make plans myself to do that.
So if we were to take it back to the very beginning of, did you from a high school perspective know you wanted to do physiotherapy? Did you explain that journey of how you started that and the process of, did you know, okay, I'm always going to be a physiotherapist, or did you want to do something else?
Yeah, 100%. I wanted to do something else. I actually wanted to play footy at a high level.
Oh,
So
no, okay.
I played a lot of Aussie rules. I loved playing footy. That's what I enjoyed, but kept getting injured. I was lucky enough, I was doing a Bachelor of Exercise Science at the time. Even during the Bachelor of Exercise Science, it's not like I knew I was going to become a physio. During the middle of it, I was like, okay, what's the next best step for me? Was to become a physio. So it was just like the next logical progression. It wasn't like this,
Like you've
childhood destiny that I was going to be a physio that I always knew. No, I was just finding my sort of next step as I went along.
For those who don't know, so you've done, Bachelor of Science, you've now, was it Bachelor of Exercise Science, and then now you're progressing into physiotherapy. At what point do you realize, okay, this is what physiotherapy is? And for those who don't know, can you explain what actually physiotherapy is?
Yeah, so physiotherapy is quite a diverse profession. What I'd like to sort of summarize it as is pretty much anything that uses movement to help with your body, whether that is a bone, muscle, joint issue, a cardiorespiratory issue, a neurological issue, or a vestibular issue. We can use movement to actually help people. And the cornerstone of that is being able to diagnose what the issue is and then what movements are going to be most helpful, but then being able to do that through some tests that we apply and then giving the right intervention of movement to help people. And some of these movements that we do, whether that's an exercise or manual therapy or these wacky maneuvers we can do in vestibular physio, it has been proven to be effective across a lot of clinical trials that they've done. So it's a lot. It's a lot more favorable than using something like medication for a lot of our customers. They rather do a movement-based therapy than take a medication or take injection therapy or go through surgery. So it's a really good, cost-effective alternative and something that is more favorable for them.
Awesome.
When you took over, were there moments where you thought this is too hard for me, or was there certain challenges that came upon that you kind of had to take it on the chin and move on?
No, there wasn't ever a time where I felt it was too hard for me. I think like there's obviously a lot of stresses that come, but I think because it's not like I expected it to be a cakewalk either.
Yeah.
Like I knew like people are going to come into the company, people are going to leave the company. There's going to be financial stress, all that sort of stuff. But like I grew up with that stress. I know what that's like. So I don't think I was like, oh, I'm not made for this. Okay. Or I wanted to put the white flag up or anything like that. I think it was just a case of, well, it's going to happen. This is what I want to do. What is the alternative is going back into an employee position, which is not going to sit well with me.
Yeah.
So it's like, this is who I need to be.
Yeah. Because why I asked you that is I did some research, and initially when you took over the clinic, the head podiatrist you had kind of left.
Yeah.
And you had 80 to 100 patients where they had nowhere to go.
Yeah.
So how did you mitigate around that situation?
Yeah, pretty much. This is the good thing about having these sort of ideas and plans in the background is I sort of almost anticipated that would happen at the time, should be told. When that did happen, I already had X, Y, and Z contact that I knew I could reach out to and bring on board. And I also knew, alrighty, I've done my sort of study. I haven't done professional study, but I've analysed what like a podiatry side of a business would looks like and does. So I know what I need to implement as a framework to keep this sort of caseload going.
Yeah, because most people would have took the quick fix route, would have patched the hole, but you kind of remodeled the framework.
Yeah.
And instated new physiotherapists. So when you were, new podiatrists, when you were hiring, what were you looking for?
Yeah. So it was really based on personality.
Yeah.
We were looking for obviously people who are eager to learn. I want fast-paced people, people who look at a caseload and go, oh, yes, this is a busy day. I like being busy because when I'm not busy, I get tired, I get demotivated because it's not high energy. I want high energy people who are willing to learn. Want people who had an attention to detail. So it's really based on that. And then that gives us the sort of foundation for us to provide whatever training, mentoring that they need to succeed, whether that's professionally and also outside of work.
You described high energy and personality traits, and then so taking it back to the journey of, exercise science, and you pursuing, say, physiotherapy. You described some attributes like high energy. What else should someone that's an aspiring physio, what attributes should they have as they climb the ranks? And what is the process of becoming that fully fledged physiotherapist?
Yeah, I think I've been able to work with a lot of physios now and a lot of students now, so I can sort of break it up. I think it's just the mentality to be almost consumed by activity. When I say consumed by activity, it doesn't mean like study or anything like that. Like you can spend a bit of time research, but if you have an hour or 2 hours during the day where it's free, just do something, whether sort of go to the gym, study, go to work, just be productive. Okay, just fill your life with activity so that you just get used to it. And then when you have a spare hour, you're always doing something. That usually creates a good foundation to sort of succeed, because if you are so used to that one, you don't get tired by work. You don't get burnt out by work. Burnt out, it's not even in our vocabulary. Like it doesn't exist. It's just a case of, I got an hour free. Let's do something. And you can choose whatever you want to do. It can be professional based or whatever. But I think it's either going to be working on yourself, working on your career, or having a better sort of social or family or friend relationships. I think that's what makes a good foundation to be a good physio, really.
And I think it's important because being around a lot of medical health, say workers or experts, or even my world, more than the studying, like you said, it's the practicality and the practical elements. It's the relationships that you build, or practically actually practicing the physio or doing hand-on experience is what helps when you climb that. So then you've started at, I think Adam said at the, is it the podiatry that you started at? Or
so pretty much at in like 2022, end of 2022, I had to take over the business, which is both dual discipline. So it was physio and podiatry. So I was taking over the physio and the podiatry part of it.
How did you get into that business in the first place? What did you start as?
Yeah, because at the time you were 24, 25?
I think 24, 24.
So what was that? Like, where were your mind? What was your mind at when you were taking over the business?
Like, I wasn't over, like, I don't know. It's not like I crossed this line at 24 and I was like, oh, yes, here's all this sort of success I've done and now I'm a business owner. It never felt like that. It was like, oh, I actually have stuff to do right now. I have a ship to stabilize. I have a brand, a philosophy that I need to bring in January next year. It was literally December the 22nd that the business turned over to my hands. And then January, I needed a plan to get my employees to be able to bring this new system and this new brand to play. So it wasn't, it wasn't like, I've went past this finish line and I was like, oh, yes, now I've done it. I was like, no, we got something to focus on.
When you take over a brand, right? People think it's so easy, everything's in build, everything's, but it's not the case. And someone who's been through it, that's not the case. In terms of that's awesome how you describe like systems and employees, because employees, I think, is the bloodline of any business. When you looked at it from an external point of view, what needed change and what created the most difference to a business?
That was pretty much, it was a whole deconstruct, reconstruct. Okay, so I'll be honest with you, I wasn't happy with a lot of things at the time. Whether it was admin processes of how to bill a patient through like Medicare or something like that, or how to do fast, efficient claiming through digital platforms, or let's say the clinical side of it is like the clinical standardization of care across multiple physios, where we should be working towards the same sort of effective treatment. Everyone had these different treatments for these different body parts, and which didn't make sense because there's a set structured way we should be treating things.
When you say treatment, is it because they more utilize passive treatment?
No, yes and no. Is like that can be one thing. Some people can overutilize passive treatment. Some people can overutilize active treatment. So I had a physio that would overutilize passive. I had a physio that would overutilize active. Whereas we go, what is the research telling us? What do we actually need to be doing? Which is usually a mixture of both, okay, and finding the middle ground. Now, when you try to apply these things on as a new owner, it's not like you walk in and be like, hey guys, this is the evidence-based practice. Let's get started. Let's do this way. No, there's going to be opposition. There's going to be people fighting against that flow. And it's about, those are the sort of challenges that we sort of anticipated in January. We knew that was going to happen. So that's what I was getting ready for.
So you need that knowledge to back you up when you go into that. Where does that knowledge come from? Is it through the practice, or did you have a mentor, or things that you're consistently researching at the time?
Yeah. So in my first 2 years, look, honestly speaking, I wasn't mentored a lot. I didn't go into a graduate program or anything like that. I went into a full-time physio program where I had to be an independent physio. So I learnt by myself through sort of reflective practice. But when I'm in reflective practice, it's like doing something, assessing a patient, treating a patient, and then pretty much going back and saying, am I doing the best thing possible? And if I feel like I was a little bit unsure, let's do some sort of research to figure out what I could do. The other thing that I did in my first 2 years is I probably smashed out around 10 to 12 short courses on weekends. I've traveled to Sydney up and back multiple times, got some credentials and licenses with particular physio treatment techniques that are quite sort of robust and evidence-based, so that I could go, I got the knowledge, I got the evidence base, and if I'm trying to build a brand around me with other physios, I know what I'm talking about. Because you can't be naive and think, oh, I'm going to start a physio company and I'm going to get going and not have the knowledge behind you. Because if you don't have the knowledge behind you, people can see through that.
For sure.
From our conversations, we're going to jump back into a little bit of the podiatry stuff. You've quickly picked up on they don't have much musk training.
Yep.
How did you implement a system where you could fill that gap?
Yeah, so pretty much the musculoskeletal training of podiatrists, I think, could be a bit better. Okay, I think there is some must training, but things that might be omitted that I think the universities are working on are things like exercise prescription, strength and conditioning prescription, because these are the evidence-based approaches for things like Achilles tendinopathies, plantar fasciitis, those sort of things. But I think a bigger mission is manual therapy in the curriculum that could potentially change. Yeah. Yeah. So what I did was I looked at, okay, we have these podiatrists, these graduate podiatrists that don't know too much about this. Well, this is something that we can offer. This is something that can really excite them. It's something they can really implement, knowing that they'll get better patient outcomes. And when we advertise that to upcoming podiatrists, they're really excited about it because they're like, oh my God, I've never heard of this stuff. Here is how this sort of integration of physio and podiatry can be a big strength to us as opposed to a weakness.
Physiotherapy is sort of, I guess, a proactive approach, and sometimes it's, like you said, it's treatment, but it'd be interesting to know as well as, rather than a reactive approach, what are some preventative measures that people can take? Well, because someone who's an active gym goer or even athletes that I hang out with, what would you suggest to them as a preventative measure?
Yeah, so pretty much it's on a case-to-case basis, really. So whether you have a shoulder issue or a lower back issue, maintaining just good range of motion through any joints in the body is important. People think that is down to muscular stretching. Sometimes it's not. Okay, it can be joint-based stretching, which is different. Maintaining strength through a range of motion is important. So what we mean by that is, let's say with your shoulder, if it goes all the way up above your head, is to obviously help develop the strength lower down, but make sure you do some things at that end range overhead to build up that strength through the range. Yeah. So that way you have strength through the whole range of motion, as opposed to, let's say if you only did pushes or pulls, you'd be really strong lower down, but overhead you'd be pretty shit. Yeah.
Because you're, from what I picked up on, you're very articulate on your diagnostic approach and your treatment accuracy. What do you think that separates you from an average physio and a great physio?
So average physio, I would probably say it is, the diagnostics, in the sense that I think, especially in this sort of realm of like Instagram, social media, where you have a lot of physios there, which sometimes can muddy the water a bit, like, oh, you can't be too specific. Well, we do all of our training to become specific. My whole postgrad has been about being specific. Okay, I'm getting into more diagnostics. If we diagnose an issue properly, we can apply a validated evidence-based framework that has been shown to be effective to help. So hence then the onus is on the diagnosis. Okay? The difference between me and a great physio, I'll probably say, is a case of, well, there's a few things with diagnostics. One, we look to diagnose what the issue is. At the same time as well, we like to test what it's not. And at the moment, we'll test one or two things that it's not to rule that out. I think a great physio knows how to prove what it is not beyond reasonable doubt.
Because you come across a lot of complex patients with a lot of pain drivers, vague history, a lot of psychological layers as well. How is your process on getting down to the point and breaking things apart?
So it's pretty much, I like to say, putting things into shopping baskets. So we talk about reasoning categories like, okay, the person says they're stressed, so I put this into a mental basket of, this is a psychological factor going on. Or they say, oh, I get anxious because of my pain. I put that in the psychological basket. But then they say, oh, I can't go swimming because of my pain. So that's an activity restriction. And I put these into all these different baskets, and I go, all right, so I can see what their psychological state is. Maybe their fitness is low. Maybe their range of motion is affected. What is the one thing that I can work on today that's going to have the most meaningful impact on everything? Okay? If possible. So it's literally that, and just keeping it that simple, because you can't work on everything all at once. Yes, it'd be, and patients don't have the time. If you ask them if they've done the exercises, they haven't. So picking one or two things to work on and seeing how it affects everything.
you've done postgrad studies on the Mulligans and Mackenzie's.
Yeah.
Could you elaborate? Because most of the students don't know what a Mulligan's concept is. Could you kind of elaborate a bit more on that?
So pretty much Mulligan's is mobilization with movement.
Mm-hmm.
So with, let's say, a standard mobilization, what you're doing is you're getting someone still and then you're applying a mobilization. So you're physically doing that force to the body.
Mm-hmm.
So let's say at the joint level, the joint's moving probably a little bit, maybe a millimeter, maybe it's not.
Yep.
With mobilization with movement, you apply the pressure, but then you get the patient to move. So then the joint moves through its entire plane.
Mm-hmm.
Okay. And because there's more motion that occurs as opposed to that 1 millimeter of movement, it's theorized to give a bigger effect because you're getting more sort of mechanoreceptors involved.
Yep.
Motion is lotion, as everyone says. And it is, when applied appropriately and within the guidelines, it will allow you to have a large pain reduction effect or range of motion improvement effect.
Yep.
Is there a case study over the years that has stood out to you that was something maybe complex that you came across and this was the solution and this is how you work through that case study?
Yeah, pretty much. It's like someone comes in, neck pain, headache, like a severe 5 to 6 out of 10. We know it's coming from the neck, okay? It's constantly there. Then we just apply a little bit of pressure here. We sustain it, which is one of the Mulligan's techniques, okay, along that joint plane. And then after 20 to 30 seconds, that 5 to 6 out of 10 is gone. Yeah. So, and only needed to touch the patient for 30 seconds.
Personal question, posture. Yeah. Is that something that a physio can assist with?
Yeah. Yeah, I think it's also debunking posture too. So people will worry about posture a fair bit. Whereas we find that it's only a driver for some people's pain, maybe 20 to 30%, not a lot. Everyone has a different architecture. So some people can sit straight, some people physically cannot. So then asking those people to sit straight is actually to their detriment because they can't. So I think it's just taking it from a case-to-case basis. When there's people where their posture is an issue, there are different interventions that can be applied. That can be something like ergonomics, okay, like something behind your back to sit you up straight or whatever. If it's a strength problem, like they don't have the strength to get there, yes, we can assist with the strength. Maybe they're stiff into that direction. We need to get them stretching or mobilizing them to help them adopt that new posture. So, yeah, those are the sort of interventions a physio could help with.
Someone who's going to the gym, right, or an athlete, what can they do as a, say, warm-up and a cool-down measure prior to their sort of exercise training? What would you suggest? Something.
Yep. So pretty much, let's say warm-up is pretty much movement prep, okay? So if let's say your activity is all it is bench press, there's nothing better than actually just doing some low max voluntary contraction bench press, like 20% building up to 40, 60. That's going to be specific to help you then hit your 5 RM or 1 RM.
Yeah.
We like to make warm-up specific. So let's say you're a footy player, some dynamic sort of leg swings. We advise against static stretches in those sports because it increases the length of the tissue, and if it stretches more, it can actually increase the risk of it rupturing. So no sort of static holds. Yeah.
Yep. That being said, how do you balance our evidence-based framework with adapting to what actually works in the real world?
Yeah, 100%. So to be honest, the evidence-based framework should be what works in the real world. You can evaluate you've seen me open up a journal article. You'll see when I open up a journal article, I go straight to the methodology section. Yeah. So I look at, okay, have these researchers put the right method in place to find a true effect, and as opposed to the regular person that will just look at the abstract.
Yeah. And do you ever feel like physios get caught up in the protocols itself rather than focusing on the bigger picture?
I think what the protocols are there for is you can grab part of a protocol and then apply it. You don't have to apply the protocol fully. I think, yes, that can be something. Get the converse as well is where people are just so blasé and not using any structure. So I think there is a spectrum.
Yep.
Yeah.
So when you've graduated, how did you kind of implement evidence-based practice?
Yeah. So I started blasé. So I went, okay, what am I finding and let's try this out, okay? Because I was a graduate, and I was like, oh, this is working. Oh, this is not working. Then I compared it against what are other people doing on research protocols. And then I'm like, oh, that's something they did that I didn't do. Let's apply this next time and see what happens. Then I figured out, okay, drawing upon these protocols in some part, okay, can help. Then you have a patient where you're like, oh, let's experiment this time. Let's get them through the protocol. And then you realize some of what they're presenting with matches with the protocol and some of it doesn't. So then the protocol in its entirety isn't applicable.
So what I'm noticing is the constant drive to learn and exceed. Like no matter what or level you are, you seem to have the, you want to learn and exceed more.
Yeah. Because growing up, you weren't always knowledge driven. How did you become a knowledge driven person?
I think it actually came out of necessity more than anything. Yeah. Because as I said, like I wasn't really knowledge driven. I didn't get like the best ATAR or anything like that. It was a case of I wanted to play footy. I enjoyed playing footy. It was probably one of the best times of my life. But that wasn't going to pay the bills. Okay. So I had to make something out of myself.
Was your parents hard on you in school?
We'll get into that in a bit later on.
I think, so they weren't hard on me at all. But with, let's say an exercise science degree, to get into physio, you have to, at La Trobe, you have to get an 80 WAM.
Yep. Okay? I think it's between 72 and 80.
Yeah, 70 to 80, that's what they'll advertise, but they'll only accept anyone over 80.
Yeah, true.
I had to get an 80 WAM, so I had to put my head down and focus and study. I was trying to do the GAMSAT at the same time as well. But because of that, I learned to sort of focus, because then I'm just like, all right, I've got to learn these things, I've got to learn these concepts, because if I don't progress in my studies, I don't progress in my career. And then let's say during physio studies, it's probably the same thing, as I had to sort of try to focus because I needed to get a job. Okay. Yeah. When I started working, I needed to be the best version of a physio I could, because I had big aspirations to own and drive a proper practice.
Yeah. In terms of for students and graduates in a similar situation for yourself when you were younger, if you were to put advice in one sentence, what would it be?
I think it's just figuring out. I think there's two different drives. I think some people are happy where they are, but I'm more sort of speaking towards people who wanted to sort of continue taking the next step up. I'm not a person that knows how to sort of stay in the same place. I want to take that next step forward all the time. Yeah. But for those people, I probably say, I think you got to be balanced. Okay. I think and when I say balance, I think you need to understand your sort of strengths and your weaknesses, and then lean into your strengths, but know how to patch up your weaknesses as well.
Yep.
Because you said you're a supervisor at the moment for those who are, say, for example, if there's any placements or things like that. What do you look at? What is a standout person look like to you?
Because most of your students are your employees now.
Yep.
What is what is the clinical skill they lack that you see when they come out of the course?
I'll answer both of your questions. So let's say skill that you lack. I think I'm lucky. I think I've hired a really good bunch of students over the years that don't lack too much. I think it is actually usually just a goal setting and direction for a lot of young students. It's like they don't know what next step to take, which is you're young, you doesn't make sense. So then we do a lot of goal setting training, what you need to do and what tools you require to take that next step up. Now come back to your question, which was
what do you look for while you're supervising those people doing placements?
Yeah. So pretty much what I'm looking for, obviously we'd love good performance. Okay.
You can relate it back to me as well.
But for example, in my placements, one of my worst placements, I got mid-50s, out of 100.
Adam?
Well, as in when I say I got, it was me.
Oh, right. Okay,
while I was a
yourself.
student.
Yeah.
I was a student. So it wasn't I was I was a 90 student in thing as well. But what I look for is when I give them feedback, how quickly are them to actually take that on and potentially blame themselves, And when I say blame themselves, I actually don't mean that as a bad thing,
Mm-hmm.
because I think that is a case of ownership. Okay.
Mm-hmm.
I've had cases where if I give feedback, they look to externalize it. So it's like they go, oh, but the patient said this, or oh, it was hard because the patient was really confusing, as opposed to being like, okay, this is what I could have done. Okay. So that ownership is really important.
Yep.
I call it, well, it's not I call it, it's a known concept of above the line and below the line thinking. So I'm looking to see if they're above the line thinkers.
Mm-hmm.
If they take on feedback and go, oh yeah, I did that wrong, maybe I could have done this better, I can see that their mindset is in the right spot.
Being in the business side, from someone who's self-employed and runs their own business, I'm curious to know that transition of becoming a practitioner to then now owning your own brand company. What are some things that you sort of go, okay, more than okay, I've got the medical practice that I need to worry about, which is the utmost importance.
Yeah.
Then now I've got costs, revenue, profit. Now I've got to look at, say, the marketing side of things. So how do you, attack each sort of section when you're running a business? And how does that, how do you handle that?
So pretty much the one thing that will always underpin all of this is the fact that you need a business education.
Mm-hmm.
I have a business education. I have a postgrad business education as well.
Mm-hmm.
So then it makes it easier to sort through all of this. Whether it's a balance sheet or any stats, performance metrics, healthcare policy that comes out, I can interpret all that stuff in a blink of an eye.
Okay.
So because of that, it's easy to then go, all right, this is how we need to create systems to manage things. And that's what we do. We create systems to manage the marketing, the accounting, the financing, put middle managers in positions to be able to execute those tasks.
When you take over a franchise, do they provide you some sort of background support, or are you doing majority of the...
So the business that I took over wasn't a franchise. So it was just one little private practice.
Right.
So I had to bring that in over time.
Wow. Okay.
So they didn't provide that. So this is like, it was a small enterprise, no backing or anything like that.
What did you, and which section did you focus on first in those sections as you built up?
Yeah, pretty much quality of service, brushing the systems up. Then as we sort of took the next step up with getting more people with opening a new practice is sort of people management, okay? Making sure our staff stay happy, stay retained within the practice. And then as we get bigger, then we get more invoices coming in and more suppliers coming in. So then we have to have a bookkeeper, okay? Then the people management gets too big for me. So then I bring in a practice manager who then manages the people. Okay, then I bring discipline leads in because the physio team's grown or the podiatry team's grown.
I just want to touch on quality of service real quick. I think quality of service is one of the most important metrics that nowadays, like you said, in the social media realm is underpinned, because it's all about marketing. How can we get more customers? How can we get more customers? But what are you, like, people need to realize, what are you doing to retain those customers?
Like, what are your
Because
strategies?
majority of the time, it's word of mouth referrals in any business that drives the business growth, and loyal customers continue to return back, So then that quality of service, how do you provide, what does quality of service look like?
So pretty much what we can do is we can take qualitative and quantitative measures, sort of how my business mindset works. So obviously, let's say a patient comes in, there is a front of house service that they get. Or even before they come in, let's say the website that they look at, how clean it is, or the phone call that they make to make the appointment, how good of quality that is. That's all part of the quality. How presentable is the front? How friendly is the person? Because that first impression is so important. When they come in to the practitioner's room, is this a practitioner who's sort of well dressed, who is communicating really well, who's understanding the patient? But do they also have the technical skills to get down to business and be like, this is your diagnosis, this is what we need to do to treat it, and how effective are they in applying that effective treatment plan? And communication skills. It's in essence, it's the same across any sort of service-based business. Okay, it's just a case of how can you get multiple people across multiple sites to be able to apply that, because you're not with the practitioners all the time or with the staff, so they need to be able to do it independently.
And one thing that is evident that's sort of across everything is communication that you described. And like communication is not, I feel like, something that can be taught. Like you said, it's some of the life lessons that go to the gym, hang out with family and friends. It's something that you develop over time. How did you develop your communication?
Oh, it's a good question. I think communication-wise, like I grew up playing sport. Okay, so had to be really friendly with people on the team, those sort of things. But then when it comes to game time, you need to be blunt. You need to be, all right, this is where you need to be. This is where you need to go. And if someone's not doing anything, say a few swear words, yell at them and get them to go. But knowing those different spectrums of those communication techniques and help. The other thing is, again, this is really lucky being a physio, is that I hold 20 to 25 conversations a day with 20 to 25 different people. So as I'm working, I'm knowing how people like to be communicated to. It's not one way. Everyone has a
instant feedback.
Yeah, like some people are really reserved, so there's a specific way, or else you have a patient that comes with an absolute socialite. Okay, so you have to bring out your socialite part of you out. I'd like to say you almost have to be a chameleon, where you have to adapt, almost mirror what the energy the other patient or the other person's bringing, to be able to be on the same level as them to communicate effectively.
When you say blunt, do you feel like most physios lack that authoritative?
Yeah. So I think across multiple students' feedback, I said you need to be a bit more authoritative. Okay, I think theories-wise, reflecting back to when I was a graduate, we did go through person-centered care, and this is how you need to communicate to a patient. And I think that definitely has a time and a place. But at the same time as well, a patient is wanting to come in to see you to know that you know what you're talking about. An authoritative stance, I'm not talking about the whole session, but at certain sections of the session can re-emphasize your expertise, your knowledge, make them feel comfortable.
So if a patient comes in and they don't like that authoritative style, how do you kind of manage that?
Yeah, it's quite and that can be quite easy, to be honest. It's just a case of, all right, we just reduce the tone. Okay, but like, this is what I explain what it is. What are your thoughts on this issue? Because if they're not liking the authoritative tone, it's usually because they want a bit. They want a bit of a say. Okay? Now, saying that, it's not like we apply the authoritative tone without knowing that the patient will be comfortable with it. We can read between the lines. Okay? There are patients that come in where we know this is not a person to be authoritative with.
And do you feel like that's what differentiates between a good physio and a great physio?
I think it's
one of the factors.
I think it's a great physio. I think about like specialist physios. I think their communication, like I think everyone can get to a stage where they can do this sort of stuff. I think it's a difference between an average and a good physio. But I think the great physios are a bit more technical.
I've got 2 questions on that. So you've gone from practitioner to then business owner, and then you also spoke about goal setting earlier. So you said for newcomers, goal setting is important. Can you describe what you mean by goal setting? As a physio, how do you goal set properly? What should those goals look like? And then for yourself now, how do you goal set? Is there a difference?
So pretty much, this may not be useful for everyone, but we do personal or professional goal. So personal goal will break into one. Where do you see yourself in 1 year? Where do you see yourself in 3 years, 5 years, and 10 years? That just gives us a large scope, and then we sort of narrow it back down to the quarter. So every 12 weeks, we want to work on one goal, not multiple. Working on more than one goal is quite difficult because then you've got so many little things to do and you can't master one thing. So focusing in on one thing.
That being said, because you run around focusing on a lot of the business side, how do you kind of sharpen your clinical edge as well at the same time?
Yeah, 100%. So, as you've seen me, I feel a lot of boots during the day. Whether that's people management, clinical stuff, postgrad study, whatever. But pretty much To sharpen the clinical side, I'm lucky. I'm doing a postgrad master's. Okay, so that passively does it anyway. Two, I still have hours free in the day. I can do quick Google searches. Last week I was at watching surgery at St. Vincent's Hospital with a surgeon. Okay, while I'm on placement, while I'm running 2 businesses, while I'm doing postgrad study.
Yeah.
Just because I had a morning free. So it's again just filling it with activity. And like if the activities I like are quite narrow. Like I like to go to the gym. I like my profession. So it makes it easy for me to do. Yeah, gaming. Yeah.
It's funny, isn't it? Because even with me, when my life or like thing is not filled with activity, you get into a shit space. You get into a shit headspace. I like filling my day with activity. I can't lounge around, and you need those days where you're just chilling and doing nothing.
Yeah.
But when that's consistently repeated, you go into a negative headspace. I'm just like yourself, where I need to be doing something,
Actively doing something.
anything to stimulate my mind. If it relates to your profession or gets you better, then even better.
Yeah, exactly right.
Yeah.
And the funny thing is, you should see the sensitivity on his mouse. I can't even use that.
What's the story behind that? What is it?
So the sensitivity on the mouse is, I think it's like 12,000 pixels per inch. So it means pretty much if you move it just even a millimeter, the mouse will go to the other side. The whole point of that is that, I can work quick.
Pace.
Pace. Yeah.
And he got me to do something on the computer, and I couldn't even see.
No way, he's just flicking around.
Through.
It's like I am curious about, because I'm very curious about the drivers behind people. Like obviously you said that, okay, you wanted to do it for yourself, you fell into it, but then like the drivers of at the start of, like I want to get into family a little bit if we can, because I want to get into the drivers. Yeah.
But let's finish off with the clinical side and the physio side first, and then we'll get into that a bit. And I'm sure that'll be interesting to hear. In terms of, because a lot of your ex-students are employees now, how was that shift for you going from student to employee? What sort of behavior shifts did you pick up on?
Yeah, it's a good question. I think I was lucky. I was even when I was working while I was a student, it was just bringing professionalism. So didn't have too much of a shift.
Was there a difficulty when you were in terms of differentiating that mentor role and employee, and going into that employee role or employer role?
So from employee to employee. Yeah. There's a few things that that changed that you didn't realize would change. So like some of the employees that I had, colleagues, and then I became their employer. So then we went from being like close friends to less close friends, because now I'm their boss. Okay? And that's just something that's intrinsic. You can't help that. Okay, even if you employ someone in the future and like really great vibes, whatever, you as a boss, and because I spend most of my time at work as well, is, and to be honest, you're actually foregoing friendships.
Yeah.
Okay.
Because I feel like one thing with you is most of the supervisors and mentors that I come across, they fail to implement open feedback and healthy conflicts. How do you kind of approach that? What's your way about it?
So I love conflict. Conflict is great. So I think we're not really politically correct, or we don't really try to sugarcoat things. We just say it as it is. Okay. So, and I've chosen people who can take conflict.
Yeah.
I've chosen people who, if we disagree on something, we know that person across the road that's disagreeing with me has my best interest at heart.
Yeah.
Okay. And then as a leader, you need to show that you're okay with inviting conflict.
Yeah.
So let's say you have an idea, you have a plan, you have to ask them, do you guys have any feedback, or what do you actually think? So that you can take that conflict too.
And there's also, because you pride yourself teaching your students and you want them to see doing better than you as well.
Yeah, 100%. My goal is to see them do better than me. I'm not like, to be honest, a lot of my clinicians and some of my students I've had are actually a lot brighter than me.
Yeah.
Okay. So they actually have a lot more potential to be great some of the best physios
Yeah.
than I do. So he's just setting them up for that.
I'm going to ask you a loaded question. If one of them goes, I want to open up my own clinic, would you feel competitive, or would you be like, oh, that's great?
Oh, they actually already have. I've had a girl go open up. She's had her own clinic for a little bit. Okay, and good on her. And we still keep in touch. We still talk. She asked me business questions, and I still ask her. The thing is, like, I don't need to sabotage other people's brands.
Yep.
Okay. My brand will do its thing.
Yeah.
Okay. I'm hyper competitive. Okay, but I'm not toxic competitive.
Yeah.
Okay. I make jokes about competitors. Don't get me wrong. Okay. We all.
No,
do.
that's funny.
We all do. But like, I love being competitive because we want to be the best. Okay? But we don't want to be second. Okay.
Yep.
But I'm not. I don't need to hold grudges or anything like that. I don't have the mental space for that. My focus is just driving what we currently have.
Yep. So in terms of your business currently, where do you see it in the next, let's say, 5-10 years?
Yeah, look, it'll naturally grow. Okay, I think even with how our clinics are at the moment, so it's pretty much 2 to 3 years since we started one clinic and it's second clinic. Like, we're at capacity at both clinics at the moment. We know what's going to happen next. Okay.
Yep.
So yeah.
Is the next clinic coming sooner or later?
Sooner. It's the sooner things get started, the better. Because it's just then if you start later, then you lose 1 year or 9 months that you could have had it grow.
Will you ever step back from, because say 1 clinic, 2 clinic, and then say progressively that expands, would you then step back and again take on the operator role, or would you never stop actually, say, practicing?
So I think practicing I just enjoy. I don't need to do it.
Yeah.
I just enjoy doing it. Okay. And I think it's good to understand current patients, current service delivery, and that your clinicians can see that you're doing what they're doing in a way. You don't have to do that for 38 hours a week. You can do that for 5-8 hours a week. Okay. But it is, it's more, and doing a bit of clinical work, but at the same time as well, is my role is more quality control at the moment. So in the sense of all these clinicians coming back to me being like, this is what I'm doing. What could I do to do better? Okay. So they have that person there to go, all right, this is what alternatives you can try.
What does your week look like at the moment as an operative perspective? Is there a day that you just go, I'm not doing anything, or is there always something on?
There's always something. Yeah. Like for example, today is a Sunday. I've worked Monday to Saturday. This is my day off. What am I doing on my day off? I'm making up a PowerPoint at the moment.
Yeah, right.
On some training and some content delivery I need to do. Yeah.
Awesome.
Because
he has an extensive list of short courses that he's done, which is very good.
Yeah.
Actually, we'll touch base on that. What are some of the courses that helped you to become a greater physio?
Yes. So it's a funny question. I'll probably get in trouble for saying this. Okay. So as a graduate, I went and attended some courses that were meant for, like, this was like 2 months out. They didn't put the requirements in at that stage. They did it afterwards. Yeah. But it was through Australian Specialist Physiotherapy Education. So usually for titled physios that are looking to like specialize. So instead of doing like your lumbar level 1 or your cervical level 1, which is more for you sort of graduate early on, when I did the advanced stuff. And yeah, at the courses I felt so out of my depth, don't get me wrong. But then like it was still great. Took a lot of notes, all that sort of stuff. Yeah. But it just helped me understand what this upper echelon of physios are doing. Yeah. So you can just unpack that and try and replicate it.
You learn to swim in the deep end, don't you?
Until you make it.
Who was there any physios when you were coming up that is killing it in this space that you still look up to at the moment?
Yeah, there's definitely, and definitely a lot that I sort of keep in touch with as well in LinkedIn. We talk here and there, but yeah, there's plenty that I go, yeah, what you're doing is great.
So you and I guess there's an aspiration to get to that stage or to that level. What are they doing at the moment that sets them apart?
They never stop learning.
Yeah,
they never stop learning, and I think that's what sets them apart. And they're passionate for what they do, and they don't get tired from their work. Okay, their work empowers them; it doesn't tire them.
Okay. Yeah. In terms of for young physiotherapists like myself or students, if they want to own their own clinic, what sort of advice or leadership advice or ownership advice would you give them?
Learn to walk before you run. Okay, so you got to know your stuff. I think I see some graduates try to start up prematurely. Like even I had to learn how to learn about evidence-based stuff. Okay, and learn how to run a business in the background. So learn that properly. Be humble. You don't know a lot. Okay, and it's okay not to know a lot.
That's facts. Yeah.
Okay. Don't go on social media and preach to the world, because you are at the start of your career and you can think that you know as much as you want to know. There's a steep learning curve coming ahead. There's something they call the Dunning-Kruger effect. Have you heard of that one?
I actually haven't.
Yeah. So pretty much at the start, when you have like really little experience, because you think that you know a bit of things, but you don't have extensive experience to know what you don't know, your confidence and your cockiness is quite high. Okay, so people can tend to be like, "Oh, I can do all of this." Okay, whereas then give it 5-8 years, you realize there's actually a lot you don't know.
It's interesting. I've noticed that in every discipline as well. I'm in the finance realm, and then you sort of go, "Okay, I know everything because things are going well," and then you hang out with someone who's been in it for say like you said 5-6 years. You hang out with them like, "Wow, this could have done differently," or you could tweak here something, or it's all about and then it's because a lot of physios that are now getting into it are going down that social media path, and that the flyers and the posts, and some of them that come to me like, from a marketing perspective, like, what I'm doing is not working, and I'm like to them, well, you need your customer base, your client base to support that. So then for those physios that, like Adam asked, that are starting out their own clinics and going down that social media path, it should really be, okay, start in a clinic, know your stuff, and slowly then expand, and then create your own social media presence, and then build it out.
Yeah, I'd agree with that, definitely. It's so much so that I think our social media stuff is so minimal at the moment, mainly because that's not where our patients are.
Yep.
Okay. Our patients are seeing doctors, GPs, surgeons, those sort of things. That's where they are, and that's why we look to advertise. They're in offices. Okay.
Yep.
So we go to where they are. Social media, they have no relationship with your brand or anything like that. Starting there, you can start on that later, but starting there, you're trying to advertise to people who has no relationship to you, in the mindset potentially for physio.
Correct. Yep, I agree. I want to get into the juicy stuff. You've spoken.
Brother said juicy.
We've had a conversation about your family.
Yeah.
Growing up, you had no relationship with your dad. How did that shape you growing up?
I think it's it's almost taking that role on. I guess it's just like you got to do things for yourself.
Yep.
Like there's no support there, so you have to be the one that's there for yourself, pretty much.
Do you think that's part of the reason why you push so hard and you do so well?
Yeah. Yes, definitely, because that's I'm not waiting for someone to come save me. Okay, I'm not waiting for someone to hold my hand to help me take the next step. I figured that out myself. I'll do that myself. So I'm not a victim of anything. Okay, I'm a person who's been born and bred to figure things out myself.
Yep. And it can also, like, it translates into your work, because you say you don't see your career as a job.
Yeah.
You see it as a passion. Do you think it's because it became your way of coping?
Yeah, so pretty much early on, I did probably want to think about life too much.
Yep.
Okay. I think it was just a case of filling myself with so much activity and so much things to do that I could just focus on what's in front of me, as opposed to thinking about things outside of work.
Yep.
So I think doing that then made me start to enjoy work a bit, because it was my happy place.
Yeah,
that makes sense. And that's why even nowadays, let's say for our clinicians and our practitioners, it's just about creating a safe environment for them as well.
Yeah.
When you start progressing and you're so involved in work, what naturally tends to happen is there's a separation between your social life element and work and, say what you're practicing, what you're passionate about. And during that time, I think what happens is there's a separation between friendship groups and who you hang out with as well. Did you notice that with yourself and you sort of had to go, okay, these are friends that I used to hang out with in high school. This is what I'm doing at the moment. But there is that gap or that difference. Did you notice it and how did you deal with that?
I had a friendship group in high school and that happened. The reason is they didn't come from
where you came from.
Where I came from. Okay, they didn't have sort of my background in like not having money or needing to struggle for like the simple things. It was a case that, what do they do on the term holidays? Go up to the Gold Coast, come back, holiday, have a beach house here. What's happening during July? They're going to Europe. Can't afford that. Okay? I'm trying to afford to just eat, pay the rent, and do things. So naturally, we don't have those experiences together. So then, therefore, those things start to fall apart. Not only that is obviously I'm quite driven, and they're not needing to be that. So therefore, that invites a bit of conflict because I'm like, why aren't you guys wanting to be successful together and do something and make something out of yourself? As I said, I don't know what it's like to tread water. They're happy to tread water. I will make friends with people who are driven.
Yep.
And so naturally that separates. And look, I think that's just the natural course of things. And if I had tagged along with everything that they were doing, none of this would have happened.
Chris Williamson, this podcaster that I listened to, he interviewed someone, I can't remember who it was. I think it was Alex Amosi, and he describes it as this sort of lonely chapter. It's when at the start you kind of are hanging out with everyone, everything's going well, and there's this period where you're kind of figuring out which circle or who to sort of hang out with, and that happens. And then when you get to that next stage, you're kind of looking for circles to hang out with and branch into. Were you looking at circles to branch into? Did new people come into your life
or was
at
it
that stage? Or
certain people that you picked up along the journey, such as a partner?
And you would have got some, exactly.
Yeah, so pretty much I think no partner, but I think it was a case of I had some guys that were like great with being driven and business orientated. And like I have a lot of respect for them. They do the hustle, some girls like that as well. But then they're doing their hustle too. So we'll talk once a month. You know what I mean?
Yeah.
Because they're flying around the country trying to drum up business for themselves. We get that. I think the role that I have is a lonely role. Don't get me wrong, but it is. I'm actually not fussed about that one bit, because I've grown up needing self-reliance.
Because you briefly spoke about some of the struggles you went through. Is it okay if we mention a few of these? Because you've gone through sleeping in cars, sleeping at truck stops. How did that kind of translate into who you are now? Did that create a sort of resilience for you?
Yeah, I don't need comfort.
Yeah.
Okay. I don't need to go on a holiday. Don't need that. Okay? Like if you like, I'm in a place, I live by myself where all I need is just the bare essentials.
Yep. And how does that kind of flow into your mentorship the students that you mentor?
Yeah, I think it's just a no BS mentality.
Yeah.
Okay. Like very sort of like minimalistic attitude to what you need to get done, and not needing the fancy bells and whistles to do that.
Yep.
So, and I think that comes down to the sort of keep it simple, stupid stuff that I do with everyone.
Yep. And coming from a South Asian background, have you felt like it was much harder for you compared to some of your colleagues?
I think I'm lucky in a sense that I work for myself.
Yeah.
Okay? I think socially growing up playing footy, being the only brown kid there, then potentially like there was like struggles assimilating those sort of things. I don't think I was really ever sort of accepted, but yeah.
Do you feel like that's given you an edge?
I think actually it's funny you ask me. I think the edge is I think as a Southeast Asian background, like the world doesn't, I wouldn't say recognize you, but like,
They look down upon you.
maybe look down,
Yeah.
but who knows? But like they don't, it's like they don't perceive you. It's like you're invisible. Okay. Which is completely fine by me. Okay. The reason it's completely fine by me is no one pays attention to anything that I'm doing. Okay. Which is completely fine. And I can accrue and build up myself and everything I'm doing and not getting any attention for it, which is great.
That's awesome. I think that's cool that he said that, because that's something that I've always thought about as well, is in the niches, right? Like for say someone from a South Asian background, we're in the niches, and then you see specific people in specific realms excelling at what they do, you know? So I think that's awesome.
Yeah.
That's a good thing to.
And I think like unfortunately, like everyone's stereotype where you come from, okay? Whether you're Arabic, whether you're Southeast Asian, those sort of things. I think when someone perceives a brown person, they don't see them as a threat. Okay? They see that as potentially someone that they can turn into someone that can bully or harass. Really, okay. So I think getting to a point where you can't be bullied, you can't be harassed, that so much so that they just like people just like you're invisible. It's actually completely fine now.
Yep. So it was kind of that having that no safety net, and was it about proving to others or more proving to yourself?
Prove it to others. No, I don't care about others. No. I have nothing to prove to anyone but myself.
Yep. And in terms of like your family relationship, how was it? Because I know you have brothers. How was it with your brothers? Was it very competitive, or did you have lots of...
We weren't competitive. It was just a case that I think we had to take care of ourselves for ourselves.
And did you guys kind of look after each other, or did you have,
I think
what was your relationship?
We had to do separate things.
Okay.
Yeah, we had to do separate things, and we couldn't bounce off each other too much because there's enough going on in our individual lives that we had to focus in on that.
It's when you said two brothers, wasn't it?
Yeah.
Yeah, two brothers. When it's all brothers in a family, you notice that naturally there is competitiveness, or there is, like you said, doing independent lanes, but then you come together to help because you've always got each other's back. Like just before you mentioned, you know, your brother's a construction manager is going to be coming in just to do some stuff around you, and then vice versa, you're helping out. How important is that camaraderie with your siblings and family? Because a lot of people, they take that for granted and they, you know, don't see the importance in that. It is important nowadays.
Yeah, I think it hit me a month ago. I had a patient, only child, only has her mum, and she's like, her mum's about to pass away, and she's like, oh, when my mum passed away, I actually have no family left. So there's no brothers, sisters. She's living with her partner's thing. So I think despite of like what other paths that you have to separate in, it's always good eventually when things come back to place.
Is that what you kind of did with your team here? Having not as a good relationship with your family ties, you've kind of built a second family?
Yeah.
Is that what you've tried to do?
Definitely, because it's just like you can't have that at home. So then you got to create an environment that is reflective of what you want out of your life. And then, definitely. Yeah. Because it's just like I don't have kids or anything like that, or I just got to take care of the people around me. And I think, I think that's I don't think people can see that in me as well. The employees can see that in me, so they know it's coming from a genuine place.
For NADS, what is the final outcome look like where you'll be sort of satisfied? I don't think it is a money metric. I don't think is it like family? Is it stability? Is it the drive to learn? What's
the end goal?
Oh, there's no end goal really, to be honest. I think it's just taking the next logical step and see where it takes me. I think as life's going on with growing the business, it's opened up new doors and new opportunities that I didn't think was possible. Like at the moment, I can travel the country, I can travel the world if I wanted to. I can speak to people on the edge of medical research and get on board with them. I can continue building the business in the background. So just having those options available. But I think the end goal, if I was to put the end goal, I think it's just I've built my life to obtain freedom.
Yep.
Okay. Because I didn't have freedom. and I didn't have flexibility to do things, and now I have the freedom and flexibility to do things. I'm not trapped by anything. I have the financial security and the mental aptitude to be able to do a lot of things.
Logical step, right? You've used that word a few times. Like a lot of people just say the next step. What differentiates between a step and a logical step?
Yeah, so the next step,
as in like
what is actually realistic. Yeah. So pretty much we do this with goal setting is, all right, I'm here right now. Got practice mini ponds in Brunswick. Okay. What's the logical next step? We're at capacity. We need to open up another practice. Okay? All right. We're going to open that up far southeast. No, that's too far. That's not logical. Okay. Where is a market? Where is a calculated step that I can go to open that next clinic? I've completed my postgraduate degrees end of this year. What's the next logical step academically that will help me develop better systems or better standardization of care? Let me have a think about that. Let me see where it goes. I think the computer sciences is where it is. Okay.
Yeah.
Okay. Yeah. That might be where I'm delving into.
I want to break into that as well. You described a few things and that logical step. Can you maybe in a few words describe a few steps on how you can, is it research, getting help? Look, you know what I mean? So like some segments on how you can break down the next logical step for anything. How do you get there?
Yeah, I think it's to figure out what the next logical step is. I think it's understanding what resources you have. So pretty much you can make a data bank of, all right, this is how much money, this is how much I know, knowledge bank-wise, this is how much assets, these are my physical or personnel resources as a business owner. This is the next step I propose. Then if I link them two together, is those, can I move these, we'll call them assets, into a way that'll help me get to that next step? Okay. So it's literally that thought process. Because if you can't, then it's not the logical next step. Okay. Because you can't use what you have to help you. You've just make a step because that's unrealistic. Okay. You have to use what you have to take the next step.
But there's still always risk involved. There's always a risk element of risk. And how do you balance that?
There's always risk. And I think risk early on is higher than later on. Okay. I think being okay with risk is another thing. Okay. So mentally you need to be ready to take on risk. Everything has risk. You have to be so used to it, okay, with risk that it doesn't phase you anymore. Okay, everything I do has risk. Okay, I bought things for the clinics when I couldn't afford them. Okay, and they've all turned around because it was a calculated risk. You calculate your risks, you figure out how to mitigate them, and you can't mitigate it to zero. Okay, but if you can mitigate it well enough, then they can't come into fruition.
Do you think that came from your early hardship? That sort of risk taking.
Yeah, so the risk taking, so I didn't take a lot of risks early on. The risk mitigation is what I did early on, okay? Because I couldn't make a risk, okay? I couldn't take a wrong step. If I took a wrong step, I'd probably be in debt, okay? And I couldn't get a loan to do any of the next steps. So it's a case of risk mitigation was probably a good skill that I learned.
Yep.
I want to, on that risk taking, right? So at what point, in terms of hiring staff, labor, right, towards a business, that is again another risk. It's about calculated thing. You look at, say, your revenue, profit, expenses, and then you make a calculated risk. At what point do you go, I need an extra staff on, or I need this asset to come in? Is it you're purely looking at it will do benefit for the company, or you're looking at a number, a metric?
Yeah, good question. So let's say staff on, it's based on supply versus demand. Okay, so is there, because what happens is when we put a staff member on, we're increasing supply. There has to be the demand in there to increase the supply. Because if we increase, let's say there's no demand and we increase supply, that practitioner is not going to have patients to see to bring in revenue. Okay, so when the demand is high enough at a consistent level, we increase the supply by bringing someone And we'll be so calculated with who we bring on that we've vetted them for several months, maybe years.
And you could apply that to anything, I guess, to an asset or something that you're bringing into the thing. If the demand is there, then you need something to facilitate that demand.
Yeah.
And as naturally it grows, you get to the next stage, more demand, more supply, and then it just grows.
It's the same across every products and services. Cool. What's the second part of the question?
It was assets as well. I guess it's...
Okay. Yeah, assets.
Yeah.
So assets are a bit different because with assets, you may start a service that doesn't have any demand. Okay, so there's new technologies like, or let's say we never had clinical Pilates, so no one would come and see us for clinical Pilates. So we had to create the assets and buy the assets and go, all right, will this logically give us a profit in the long run? Okay, so did the calculations on how much per class, how many people can we expect to see, do the mathematics across the year, and then go, all right, yep, they will work and it'll pay itself off in X, Y, and Z time.
Louis, we're getting that FX3, bro.
Let's just say, because initially you said you didn't have the resources to start off. Was there certain people that you turned to help you in that phase? Or was it kind of just...
As in like money-wise? Or
financially?
No, I don't have... So financially speaking, I didn't go to uncle, auntie, or anything like that. No. I bought my own place and then started taking out loans, okay, and got okay with taking out loans, okay. There's a finance concept that money in the future is worth less than money in the present. So as an accountant, you know that, okay. So pretty much if I take a loan out now, let's say I create like a nice sort of clinical Pilates studio, let's just say it's like a $20,000 loan, I'll just make the minimum repayments. Okay. In 5 years' time, instead of paying $30 a class, people are probably paying $60 a class. It's so much easier to make money in the future.
Yeah.
Okay. That I can pay off this loan as opposed to using my existing cash flow.
That's right. Yeah. Cool. And if you were to go back, was there a certain thing that you would change in terms business-wise?
Business-wise, I think I need to do better with the podiatry segment of things. I think, I think I...
So when you say podiatry, what's the next step that you would take?
I think it's getting a senior full-time podiatrist, okay, to drive innovation and technologies in like real-time ultrasound, injection therapy, those sort of things. Even prescription of medications is something we're not doing. So I think that's what I would do.
Yeah, I think that's our 1 hour. To finish off, growing up, your younger self.
Yep.
If you were to meet him again, what is the one single advice that you would give him? You can take your time with this as well.
That's a good question. Oh, I think there was a learning curve that in late adolescence that I'd have to rely on myself. I'll just tell my younger self, get ready to be by yourself and rely on yourself early. Yeah. That's what I would do. But that's easy to say in retrospect.
Yep.
But I would just say, that way it probably saves me 2 or 3 years of grief in the middle. Yeah.
I just got one last question as well to wrap things off. You said you look at clinical practices or studies that are, referenced. Apart from that, just general knowledge, what are some things that you go to that maybe the viewers can look at as well? Maybe books, references, is it YouTube videos, podcasts, anything that you sort of look into that to improve yourself?
Search engines, man. Search engines is like find a good search engine and know how to find good quality information based on methodology of things. I think a lot of stuff I read, and I think you can get whatever information you want now out of like chats, GPT systems and stuff like that. It's again, don't complicate things. Try to like people used. I'm probably different. It's like people used to give me whole novels to read about business, and they'll give you this sort of abstract way of teaching you a lesson. I can just ask ChatGPT what's the point of this book.
True.
Okay, and save 2 days of my time reading it. So it's I think it's getting good quality information quickly, and knowing how to get that quickly is really important. I'm not a person that will step away and say, I read all these business books, or I read these books about self-empowerment and how to be a leader and stuff like that. Yeah, I can read it all I want. Okay, I can actually do it.
Yeah.
It's the action. What matters. Nads, we appreciate you being on the
I have one more question, sorry.
You can ask more questions. Completely.
This will be the last one, because I think it's an important one. For future students that's going to be coming on with you, what advice do you have for them? Because there's a lot of students. Sounds like a
personal question.
There's a lot of students that are watching as well.
Get ready to be broken.
Carry the boats. Like David Goggins says, carry the boats. Time to carry them.
No.
Because I know, especially in my cohort, there's going to be a lot of students that'll be finishing up with you as well. Is there certain advice that you'd like to give them?
Probably it's just a case of just get your hands dirty. As in put the textbook down, put the laptop down, you've spent how many years doing theoretical stuff, just zero in and focusing on your patient and what you're actually practically doing. It's okay to make mistakes with that. And that's what you've done on my placement is, as you know, is like private practice, but you get real patients.
Yeah, definitely.
So therefore you can get the practical experience, because when we ask you theoretical questions, you'll most of the time know it. It is just then when we ask you to actually practically apply it or actually see a patient and do it, then it's that active, fast thinking recall that you have to do.
Cool.
Nads, we appreciate you being on the Select Few podcast. Like I said, it's awesome to know the behind the scenes of, something that you're operating, something that you're growing. And I think there's some valuable lessons, not just from a medical perspective, but also as well as from a business perspective that you provide. And it was good to just dive deep into a bit of your background, what drives you. And I think it was more than just like any sort of advice. It was more practical advice on how people can apply
realistic
that.
advice.
Yeah. And the goal with this podcast is always just, it's called the Select Few podcast for a reason. We don't do this consistently. It's just once in a while with people that we respect in specific niches. And then, like we said, it's just a conversation, and then we just sort of leave it up to the audience to take their lessons and grasp what they want to do.
And we'd like to catch up with them the next couple of years or something.
Yeah, once the next few practices open up and see how they do.
as well.
Yeah, sounds awesome. Sounds good.
Thank you so much.
That's a wrap.
My pleasure.